Okay, class, let's take a look. In a previous video, we introduced the endocrine glands. Let's take a look here at the top. We see the hypothalamus. Let's see if I can make this red, so it'll be a little bit easier to see. So on the top here, we have the hypothalamus, and then right in the center, we see the pituitary. Remember, the pituitary has two divisions. It has an anterior division, and it has a posterior division. The anterior division is also called the adenohypophysis, and the posterior division is called the neurohypophysis. Okay, off to the top right, we will see the pituitary hormone. So when I talk about ACTH, it's adrenocorticotropic hormone. TSH, thyroid stimulating hormone. Growth, GH, growth hormone. PRL, prolactin. FSH, follicle stimulating hormone. LH, luteinizing hormone. MSH, melanocyte stimulating hormone. And then in the posterior pituitary, we have the ADH, antidiuretic hormone, and oxytocin. It's important to kind of know the abbreviations. Many times when you're looking at blood work, they don't write out the full name. It'll just say LH levels or GH levels or TSH levels. So it's important to know both abbreviations and their names. Now we look up at top. I know in a previous video, you heard me talk about the HPT axis or the HPA axis, hypothalamic pituitary thyroid or hypothalamic pituitary adrenal. I only talked about two axes because you can see the hypothalamus up here sending regulatory hormones that are released, and they're going to hit the thyroid. Now, they may be a stimulating hormone or an inhibitory hormone. So we have the H, we have the P. The first one coming down goes to the adrenal gland. The next one could be the thyroid gland. So I did talk about these two, but there's other axes as well. You have the hypothalamic pituitary mammary axis, the hypothalamic pituitary gonadal axis, the hypothalamic pituitary kidney axis. You see, it's a chemical messenger system. So let's just look at the first here. The hypothalamus can send a chemical message, a regulatory stimulatory hormone, to the anterior pituitary. The anterior pituitary or adenohypophysis is sending adrenocorticotropic hormone. Look at the name, adrenocortico. Remember, the word cortico comes from cortex. What does cortex mean? It means bark, the bark of a tree, the outer layer. So when we look at the adrenal gland, you'll see that there's an adrenal cortex, which is the outer layer. That's the bark of the tree. And on the inside, we have the adrenal medulla. So by its name, adrenocorticotropic hormone, this chemical messenger is going to stimulate only the outer part, the cortex. And the cortex has what we call cortical hormones, or what we call glucocorticoids. It's one word, glucocorticoids. Okay. Glucocorticoids, by its name, gluco, maybe it has something to do with influencing glucose levels in the body, right? And one of them is called cortisol, right? These are glucocorticoids. We have cortisol, we have cortisone, and you have corticosterone. Cortisol, cortisone, corticosterone, these are glucocorticoids. You'll hear another word called mineral corticoids. Mineral corticoids. And the main mineral corticoid is called aldosterone. And the main mineral that it's going to deal with is sodium. So we have glucocorticoids and mineral corticoids. Mineral corticoids is aldosterone, the glucocorticoids. The biggie is cortisol. Most people think of that as your stress hormone, but it's really your like anti-stress hormone. It's going to help you deal with stress, try and minimize the impacts of it. Okay. It's also involved with healing. Think of when someone has inflammation in their body and they put a corticosterone patch or they get a corticosteroid shot, right? It's designed to have anti-inflammatory impact on the body. Okay. Now notice where the adrenal medulla gets stimulation. The adrenal medulla, the inside, doesn't get a hormone. Right from the neural system, right from the brain down the spinal cord, boom, right into the adrenal medulla. There's no hormones involved. That's the difference between the cortex and the medulla. Well, now we have the hypothalamus that can send a signal to the anterior pituitary. It's going to send thyroid stimulating hormone to the thyroid, right? There's going to be a receptor here. And when the thyroid gets stimulated by thyroid stimulating hormone, it's going to release T4, which gets converted into T3. T4 is thyroxine, T3 is triiodothyronine. The T comes from an amino acid called tyrosine. So when you have one tyrosine and 4 iodines, you get T4. When you have one tyrosine and 3 iodines, you get T3. Triiodo, iodo for iodine, triiodothyronine. That's T3. T4 is thyroxine. In order to make that conversion, we need selenium, that mineral, and most of that conversion is going to take place in the liver. And the thyroid gland is involved in regulating your metabolism. It's also involved in regulating growth. When we see very, very small children, when children go to the pediatrician and they measure their height, if they're a short stature, they're going to check their thyroid hormones. They'll also check growth hormone as well. So the hypothalamus can send a signal to the anterior pituitary. The anterior pituitary releases growth hormone. It goes to the liver, and the liver is going to release something called somatomedins. Somatomedins are going to influence bone growth, muscle growth, and other tissue. When you have too much growth hormone as a kid, you grow really, really, really tall. And when you have too little growth hormone as a child, then you have short stature. The anterior pituitary can send out prolactin, prolactation, so that the mammary glands can produce milk. Then we have the combination of follicular stimulating hormone and luteinizing hormone. These affect both male and female reproductive. FSH and LH are involved in testosterone production and sperm production, and FSH and LH are involved in female hormone like estrogen and progesterone, as well as in the male, it's sperm production, and in the female, it's the egg production. LH, this is what, when women are trying to plan a pregnancy, a woman can urinate or pee in a cup. You can go to a local drugstore and get these dipsticks, right? These LH dipsticks, and dip it in the urine. And if LH levels are high, it means you're ovulating. So women can track their ovulation by looking at their LH levels, luteinizing hormone. Because it's only when LH spikes that you can get pregnant. So if luteinizing hormone spikes, and it's really a short window, for most women it's about 24 hours, for some maybe 24 to 48 hours at best. You only have 1 to 2 day window for conception. Okay, because luteinizing hormone, what it does in the ovary, this is where the egg is being produced, right? So let's say here's the egg. When LH spikes, it pushes the egg out into the fallopian tube. And the fallopian tube scoops up that egg and moves it in this direction towards the uterus. As it's moving in this direction, the sperm are moving in this direction. They're attracting to one another. And fertilization should take place within the fallopian tubes or the uterine tube. Implantation, however, should take place in the uterus. Okay, MSH, melanocyte stimulating hormone, a little bit of uncertain function. They believe, I mean, not only is it involved in skin pigmentation, but they believe it has some important significance to brain function. It's still being researched, but we know that melanocytes are involved with skin pigmentation and darkening the skin, but they are also finding some relevant function to brain function. Now, on the posterior pituitary, on the neurohypophysis side, we have oxytocin and ADH, antidiuretic hormone. Oxytocin can influence both female and male reproductive tracts. In the female, it's going to hit the smooth muscle. So here in the uterus, there's, remember when we did muscle, we kind of learned like endomysium, perimysium, and epimysium. Um, the uterus has 3 layers as well. There's an endometrium, a myometrium, and a perimetrium. So the endometrium is the innermost lining. That's the layer that sloughs off once a month during a menses. The myometrium, myo is muscle, it's the muscular layer. So oxytocin is going to make that muscular layer contract. Oxytocin also affects the smooth muscle in the male of the ductus deferens, which is also known as the vas deferens. You ever heard of a vasectomy? So the ductus deferens is the vas deferens. It's the ductwork in which sperm and semen travel through. So the smooth muscle contraction of the vas deferens or the ductus deferens is also influenced by oxytocin. ADH, anti-diuretic hormone. ADH, so a diuretic makes you pee, an anti-diuretic makes you hold on to the water. So if you have increased anti-diuretic hormone and you're holding on to water, you're also going to hold on to sodium and magnesium and potassium. You're holding on to minerals. If you get rid of water, you're losing the minerals. Wherever water goes, minerals go. Keep that in mind. So what is growth hormone going to do? When we look at it, it's going to go to the liver and it's going to stimulate muscle, cartilage, bone, and other tissues to grow, to increase in size. That's what growth hormone does. TSH, thyroid stimulating hormone, is involved in stimulating the synthesis of your thyroid hormones. Remember T4 to T3. T4 is thyroxine, T3 is triiodothyronine, and it's involved in regulating your metabolism. Some people have a hyperactive thyroid, and some people have a hypoactive thyroid. If you want to learn a little bit more about what can cause hypoactive thyroid, especially in terms of stress, then I do have a video on the HPT-HPA axis. FSH, follicular stimulating hormone. So in the female, it's involved in developing the egg, and in the male, it's involved in producing the sperm. LH, luteinizing hormone. In the female, it stimulates the secretion of estrogen and progesterone, and ovulation. And in the male, it stimulates the testes to produce testosterone. Prolactin, prolactation, so it's involved in promoting milk production. Adrenocorticotropic hormone, cortex, adrenal. So it's going to go to the adrenal cortex to stimulate the secretion of glucocorticoids. Cortisol, cortisone, corticosterone, those are all the glucocorticoids. Melanocyte stimulating hormone, there's some influence over brain activity. It's still being researched, and melanocytes are involved in causing darkening of the skin. On the posterior pituitary side, we have oxytocin, and the oxytocin is going to influence, remember, it's going to make the smooth muscle, the myometrium, contract of the uterus, but it's also going to make the smooth muscle of the vas deferens in the male contract. And it's also involved in the working with prolactin for the release of milk let down through the breast tissue. ADH, antidiuretic hormone, sometimes called vasopressin. When you look at vasopressin, vaso means blood vessel, pressin sounds like pressure. So somehow ADH is going to be involved in blood pressure as well. So ADH is going to have an impact on the kidneys, on your sweat glands, and your blood vessels. It's involved in conserving body water by decreasing urine volume, decreasing water loss through perspiration, and it's going to raise blood pressure by constricting your arterioles. When your arterioles constrict, you get an increase in blood pressure, and when they dilate and open up, you're going to decrease the blood pressure. Good place for our next break. When we come back, we'll talk about positive and negative feedback loops.